multiple-choice questions based on the detailed features of Shigella SPP, with 5 answer choices per question. Each includes the correct answer, explanation, and why the other options are incorrect, focusing strictly on the data you provided. Question 1. Transmission route. A 6-year-old girl in daycare develops abdominal cramps and bloody diarrhea. Which of the following best describes how the causative organism is transmitted? A. Animal to human contact. B. Ingestion of undercooked meat. C. Contaminated water from turtles. Person to person via fecal-oral route. E. Mosquito vector. Correct answer, D. Person to person via fecal-oral route. Why not the others? A. B. Shigella has no animal reservoirs. E. Not vector-borne. Question 2. Infectious dose. Shigella differs from Salmonella in that it A. Produces hydrogen sulfide. B. Is acid label. C. Requires a large infectious dose. D. Has human reservoirs only. E. Possesses flagella for motility. Correct answer D. Has human reservoirs only. Why not the others? A. Shigella is H2S negative. B. Shigella is acid stable. C. Shigella requires a very low ID cell. E. Shigella is non-motile, no flagella. Question 3. Pathogenic mechanism. What is the key pathogenic mechanism that allows Shigella to initiate infection? A. Adhesion to enterocytes. B. Toxin-mediated secretion of chloride. C. Invasion of M cells. D. Inhibition of secretory IgA. E. Production of urease. Correct answer, C. Invasion of M cells. Why not the others? A. Seen in many organisms, not specific. B. That describes cholera or ETEC. D. Not relevant for Shigella. E. Shigella is urease negative. Question 4. Virulence factors. Which of the following is a virulence factor shared by all Shigella species? A. Shigatoxin only and S. Dysenteria. B. Endotoxin, LPS. C. H2S production. D. Flagellar antigens. E. V. Capsule. Correct answer B. Endotoxin, LPS. Why not the others? A. True only for S. Dysenteria, not all species. C. Shigella is H2S negative. D. No flagella. E. Vi capsule is from Salmonella typhi. Question 5. Antibiotic role. Why are antibiotics sometimes used in Shigella infections, especially in children? A. They increase antibody production. B. They prevent recurrence. C. They shorten the duration of illness and fecal shedding. D. They eliminate toxin production. E. They reduce neutrophil response. Correct answer C. They shorten the duration of illness and fecal shedding. Why not the others? A, B, D, E. Not direct benefits of antibiotics in Shigella infections. Question 6. Immune response. The immune response to Shigella infection is characterized by which of the following? A. Eosinophil infiltration. B. Lymphocyte activation. C. Plasma cell expansion. D. Neutrophilic infiltration. E. Macrophage suppression. Correct answer, D. Neutrophilic infiltration. Why not the others? A. Eosinophils, parasites, allergies. B, C, E. These are adaptive or macrophage-based responses. Shigella elicits a strong PMN response. Question 7. Motility and identification. Which of the following characteristics best distinguishes Shigella from other enteric gram-negative rods like Salmonella? A. Lactose fermentation. B. Motility via flagella. C. Hydrogen sulfide production. D. Cell-to-cell spread. E. Capsule formation. Correct answer D. Cell-to-cell spread. Why not the others? Neither ferments lactose well. B. Shigella is non-motile. C. H2S negative. E. No capsule. Question 8. Vaccine status. A concerned parent asks about a vaccine to prevent Shigella. What is the most accurate response? A. A live attenuated oral vaccine is available. B. A polysaccharide conjugate vaccine is routinely used. C. Only S. dysentery can be prevented with vaccine. D. No vaccine is currently available. E. An inactivated toxin vaccine is available. Correct answer, D. No vaccine is currently available. Why not the others? A, B, C, E. No form of licensed vaccine currently exists. Question 9. Epidemiology. Which of the following groups is most at risk of Shigella outbreaks? A. Vegetarians. B. Meat processing workers. C. Daycare children. D. Nursing home maintenance staff. E. Airline pilots. Correct answer C. Daycare children. Why not the others? A, D, E. Less relevant to Shigella, which spreads easily among children in close contact settings. Question 10. Clinical features. Which symptom is most characteristic of Shigella dysentery in children? A. Frothy, foul-smelling stools. B. Crampy abdominal pain and tenesmus with bloody mucoid stools. C. Severe vomiting without diarrhea. D. Painless watery diarrhea. E. Fever with steatorrhea. Correct answer B. Crampy abdominal pain and tenesmus with bloody mucoid stools. Why not the others? A. Suggests giardia. C. Uncommon presentation. D. More typical of ETEC. Suggests fat malabsorption, not invasive diarrhea. Would you like me to format these questions